Hi, my name is Lewis. My wife is 7 months pregnant through IVF, and here is my vlog. Cue intro that I don't have. So yeah, my wife and I, we are 7 months pregnant currently, thanks to the IVF process. It's been going very well. We did have one miscarriage last year. Did it hurt? Yeah, it was tough to go through, but you know what? We're here now, and we're super happy. We had a very rough first trimester. We had a few complications, hospital visits, whatnot, but now she's in the third trimester and we couldn't be happier. We are preparing our hospital bags. There's absolutely hope. If you are having trouble having kids for any reason, go to a fertility clinic, go get some help. These doctors know exactly what they're doing. Today we're talking about the egg retrieval surgery, day surgery for the IVF process. Let's talk about what you're gonna be going through and how you're gonna get there. So they need eggs to make embryos. They need your eggs or your sperm. They need both. And to do the sperm retrieval, I mean, it's just a regular day for the guys, but for the girls, here's how it starts. So generally, you know, while you have your periods, bleed out the egg, done. They can give you, they're gonna give you medications, most likely through injections that you have to take every day for a couple weeks, that makes more eggs detach and drop. We'll call them drop. These needles, whether you take 1, 2, or 3, I don't know how many times during the week. My wife had to do it every day. They're not hard to give. They're like EpiPens almost. You load it, you make sure the air is out with some of them, and you choose a point in the belly, or you choose a point in the butt or whatever. Some have to be done around the belly. No problem, no big deal. We got through it. We have an interesting story. We went to a wedding and I had to stick her with one needle. So we had to go out into the parking lot, go into the car. She reclined her seat, and well, I gave her the needle, and then we went back to dancing. So, I mean, it's not that bad. It's something that you can get over, and you know what? The outcome at the end of the day is what you're going for. So I'm pretty sure you're going to be able to take a couple needles or so. Or guys, I mean, you're not doing it. It's all the girls' work, man. I feel so bad for them, but I mean, you might have to give them the needles, you know, and just be gentle. Just be gentle. I mean, if you don't have experience. Anyway, so you're ready. You got, like, I don't know how many eggs. Hopefully you have 10 or more. If you have 6 or 8, I mean, whatever. My wife personally, she had 16 eggs ready. We found that out after the surgery. But here's what happens. So you walk into the fertility clinic, and they say, here's your gown. You put on your hat, you put on your clothing. Then they say, okay, here's your medication. And by medication, pain suppressing medication. I think my wife was on Xanax, I think. Anyway, you take your medication, wait a little bit, and then you get super dopey. Once you're dopey, the doctor says, all right, time for you to come in. Doctor puts you in, you lie down on the table, they prepare you, you put your feet in the little straps or whatever else, and you got a couple doctors in there. The doctor goes in with a needle through, through your bottom area. And what he does is he goes up into an egg, or into an ovary, or wherever the eggs are, takes them out one at a time. The entire surgery probably lasts about, I think my wife was on the chair for like 6 to 8 minutes. It was very, very fast. But she did say it was a little bit painful. When she lied down on her back, she noticed right when the needle went in that, you know what, it's fine, not that bad. But as he was, I think, changing from one egg to the other, it started hurting. So she goes, you know what, it's hurting a little bit. He said, no problem, gave her a little bit more drugs, and you know what, she was fine for the rest of the thing. Husbands, after your wife comes out of that, she's gonna be pretty dopey. Actually, my wife was drunk, kind of. Drunk-like symptoms after she left. I had to hold her hand and I had to walk her to the car. And then when she got into the car, she fell asleep immediately. When she got home, she was still pretty dopey, but she was feeling pretty good. After effects, there is no pain. She had no pain. She didn't have any swelling after the surgery. It's almost like it never happened, but I'm sure different people have different side effects. Anyway, the egg retrieval surgery was an absolute success. We got, I think, 16 or 18 eggs, I forget. Anyway, it was great. There was another woman that went in before us, and she looked a lot less dopey than my wife did. coming out. She probably didn't get that second dose of medication. Either way, the preparation for the surgery it's a task. You need to be diligent. You got to give those needles at the appropriate times of the day. But when it comes to the day surgery, I mean, I can't talk out of experiences. All my wife, and God bless her, she did a fantastic job. She was fine with it, and she was happy that it was done, and it didn't hurt as much as she thought, or maybe even she was told. So if you have any questions about egg retrieval or the whole IVF process at all, just leave a comment down below. Please like the video or subscribe if it helped you in any way. It helps me out a lot. Thank you very much. See you at the next video.